This video will demonstrate a sample patient journey. I will show some applications that are used for general surgical patients on the Vitro platform. This is the inbox that we're looking at that I currently have draft activities for, similar to an individual user dashboard. From here, we can access the clinical forms referred to in Vitro as apps, create new app activities, or view the patient Chartbook. If I click on the Chartbook icon, I can see all the activities that have been created for this patient. Patients are registered on Vitro through integration once they are admitted on the hospital patient administration system. On this Chartbook, we can see there are 68 pages. The Chartbook is divided into sections which are color-coded and named by the client. In this instance, we are looking at a surgical patient, and we can see the chart has been pre-populated with surgical apps such as consent form, an observation chart, and pre-op checklist, among others. Apps that may or may not be required, such as fluid balance charts, can be created by the user if needed. This icon is for the patient summary dashboard for surgical patients. It shows a summary of relevant details for this admission. For example, the most recent observations will populate this section once entered in the observation chart. Any information that is entered in other apps can map here, such as type of surgery, anaesthesia, as well as any recent investigations. The layout and content of this app can be changed based on the needs of a client. This is just a sample layout. If the clinical staff wish to see the admission details to get, for example, next of kin contact numbers, apps can be easily found through the search and filter options. I'll type admission into the search bar and the Chartbook will filter down. We can see we have 5 pages. When I open the Chartbook, I can zoom in to view the details of the activity I've searched for, or I can click the name below the activity and the activity will open. Most of the data fields were populated through integration from the patient administration system, and most fields are read-only. Some can be left editable to be updated by clinicians, for example, GP name. And we can also capture patient signatures. For example, on page 2 of this particular app, we have signatures for consent for release of information or for discharge at own risk. Clinical staff can view the radiology and laboratory results in the relevant Chartbook section. If we select the radiology section and zoom in, we can see the radiology report. This is populated through integration once the reports become available. This is a report for a chest X-ray. A link to the images can also be provided here so that the user can view the images without having to log on to a separate system. If we select the pathology section and zoom in, we can see the hematology report. Again, this is populated in the Chartbook through integration. To complete a surgical consent form in Vitro, we'll select the consent section of the chart and scroll to the correct activity. We can then zoom into one-page view, click on the blue app name, and open the activity to edit it. When it's open, you can see action buttons along the side and pages or tabs along the top. If I click here on the consultant's name, I can see a doctor's data source for this particular setting. I can scroll for the name I want or search. I'll select one, it'll be highlighted, click OK, and the name is populated into my chart. We can have a data source for procedure names also. When I click, I get a list of common procedures and their codes. So if I search for appendicectomy, and I'll select laparoscopic appendicectomy. We also have functionality where you can draw on diagrams or change to image, and we can upload images. On to tab 2, we can build in rules where signatures are not enabled until required fields are complete. Complete the question and my signature should be enabled. I can now select patient mode and hand the device to a patient so as they can sign the consent. While in patient mode, other apps can't be accessed, and to exit patient mode we need to enter a password. To create a new app that's not in the chart, I'm just going to select New Activity, and it takes me to the Apps tab. I want to create progress notes, so if I click here and click New, these are the progress notes, so I'll just enlarge a little bit. So in here we can add a free type note. Submit, and the note is populated with date, time, name of the user and the group they belong to. We can add photos. So just attach a photo like that. You can add a comment to the photo underneath and submit. We also have the option to avoid free type by adding stickers for predefined items. So for example, an invasive procedure sticker. If we were putting in an arterial line. And predefined fields are available for reporting. And a quick signature that stamps your name and the date and time. So now that's gone into tab 2 of my progress notes, and to read you can zoom in and see clearly. Preoperative apps can be completed in vitro, such as the anaesthetic assessment. The anaesthetist can select the Chartbook, select the clinical section and scroll to the anaesthetic record. They can view the app in full page view by scrolling to the side. Or in double page view, so that they can see other items in the Chartbook at the same time, such as blood results. So here we have a view of the hematology results while looking at the anaesthetic record. We can also look at radiology, and then come back to a full view of our anaesthetic record. The ASA status and Mallampati scores can be highlighted, and all these fields are available for reporting. Anaesthetic plan can be documented. These can be free type or available as drop downs and set fields, which are better for reporting. And once the plan is documented in here, it can be viewed by the anaesthetic nurses in theatre, who can prepare in advance of the patient arriving. We can have a data source of medication for pre-meds as well. I'm going to type check into the search bar, open my Chartbook, and I should have my pre-op checklist. This can be started on the ward and continued in theatre. So I'll just move my divider back, and we have replicated the legend that was on the original paper form. So click once, initials, click twice for X, and a third time for 0. So I can go down along my checks, and when I get to X-rays, if I move the divider back, I can check if the X-ray reports have come in. So I'm just going to clear my filters to scroll through the chart, click on radiology, and my report has come through. So I can sign for that. For the ward nurse to sign off, you just click and it stamps your name, date and time, and the one in theatre is still disabled until that column is started. A couple of pages on, we have the operation record. This can be completed on any device in any location of the hospital. And I'm going to zoom in and open the record. So you can see the patient details are pre-populated, date of surgery, and the procedure performed. The details are free type, but you could also have templates for different types of surgery included here, so you've more of a checkbox flow to it. We can add different diagrams, and you can draw on the diagrams depending on the type of surgery. Different colours can be used in different fonts. Once the patient is post-op, the observation chart and care plan can be completed in vitro. So we'll go to the observation chart, zoom in and go to page 2. Some observations have already been entered, and the next line is highlighted in blue. When we click on the chart, we get a pop-up so we can easily enter details. These can be entered manually or through device integration. When I click Submit, we can see the vitals in graph format on the chart. So we can submit these changes, and these can be viewed in the Chartbook, and we move to the post-op care plan. So we'll just type in care plan, open the Chartbook. Patient details are pre-populated as well as procedure details. Daily medical orders can be entered here with free type notes. When you click Submit, the name, date and time are pre-populated. And there's checkboxes for items to be completed and electronic signatures. On the next tab, we have the nursing care plan. We can tick appropriate items and click to initial each of these items, and all fields can be made reportable. Electronic signatures are here also. So this can be saved to be continued later. For the Discharge app, I'll go to the Apps tab, select Surgical Discharge Summary, and go to one that was already created. I can enter notes here under specific headings, and some details are pre-populated again from other apps. So I can add to the clinical interventions or summaries and type into complications, past medical history. And submit. So these details are read-only now in the app. I can add diagnostic results, so if I choose a portable chest x-ray that had been taken on the submission, click OK, it's added to the discharge summary. And I'll submit these changes.